After delivery of a baby, I think it's very important to involve the male partner, because a lot of the problems, and especially in the past, and times are changing now, especially in the past, men tended to be very much left out of delivery and postnatal care. And I think involving the male partner and helping him to understand what's going on for his wife, partner, how she's been changed by what she's gone through and how she is now feeling about the baby for whom she has to care, and that he's not being rejected, but it would be appreciated if he also was there to help. And a lot of women express this to me, that they feel that their partner is just being distant, and it's often the man's fear of not knowing how to handle a baby and how to help to care for a baby. But men can at this stage feel very left out of the whole process. In the situation after a baby's been born, we tend to allow a couple a few months to settle into perhaps a new way of life. And usually at a postnatal visit, around about 6-7 weeks, we'll ask the mother, have you started to have sex again? And you can tell by the expression if it's a real, ooh, no. Then you get the sense, well, when are you going to start to have sex again, and what is it that's worrying you? And then if we're getting towards 3 months and nothing has been happening, then it is time to sort of talk to the woman, maybe see her with her partner, find out what her worries are or what his worries are, and counsel them accordingly to whatever their concerns are. After the birth of a baby, the dynamic between a couple is bound to change. There's another person in the house. And although maybe the woman's not loving her partner any less, she's obviously got to spend time and give love and nurture the baby. So the partner might well feel rejected and not quite understanding what's happening for the mother. And as well as that, her whole role has changed. She's possibly not seeing herself as a lover anymore, and she hasn't got the time that she had before for spontaneous lovemaking, and this might push the male partner into a certain situation where he's waiting and finding opportunities, and for both of them there'll be the issue around the change in her body, because she may still be breastfeeding, and he will then not feel comfortable often about touching her breasts, which might have been an erogenous part for her, an erogenous zone. And she may feel she hasn't got her figure back. She may have a cesarean scar. The genital area she'll feel has been changed and stretched and altered. And so at this time, when there is so much going on around the anxiety of looking after a small baby, there's also quite a lot of pressure and anxiety around lovemaking for the couple as well. Very often after delivery, if a woman's concerned and she has tried to have sex and maybe it's been painful at the first try, then obviously she'll be examined, and we'll check that her sutures have healed and that there are no other tears or trauma within the vagina, and obviously that there's no pelvic infection and those kinds of things, because not everything is a psychological problem. There can often be episiotomies that have been sewn up perhaps a little bit too tightly, and things have to be changed before intercourse can be comfortable again. So patients with psychological problems can often be quite unaware that it's a psychological problem. They can perceive it as a physical problem. Maybe for the woman it's pain with intercourse, maybe for the man it's difficulty in maintaining his erection or ejaculating. And obviously both of them can be examined. Now, if we come up with a physical problem, then there may well be medication, especially for men, such as Viagra and so on. But mostly these problems are psychological, and the way we treat that is to allow the person to reveal what's going on for them in their internal world, anxieties they may have, especially allowing the woman to talk about how she feels, about how she might have changed inside. And once something's spoken about and it's there on the table in front of you, it's very much easier to deal with than if it's a problem that's going round and round and round in somebody's head. You know, why do I feel like this? Why have I got pain? Is there something wrong with me? But when she actually can say, well, I'm really afraid that when I had the baby, something tore inside me, something hasn't gone back to normal, and I've examined her and I said, well, actually everything is back to normal and is fine, but obviously you're still anxious. And she may have heard things in the past, it may be old wives' tales about things, and really the counselling or the consultation is allowing her to talk and helping her to move towards feeling the normality again of her life. And it may mean that she has to examine herself even to be reassured that things are fine, and perhaps take back her own body, because in childbirth women's bodies